All right, the urinary system, chapter 16. So we got one more chapter in your textbook, and then laws and ethics is in your medical assisting book. All right, urinary system. Be careful. There's a bunch of U terms that are very similar. We'll try to demystify them. So urinary, renal. So your renals are your kidneys. Of course, water balance and nitrogen waste. So if it's protein, then it has to be excreted through the kidneys. All right, so we got 2 kidneys, 2 ureters, 1 bladder, and 1 urethra. All right, so we got the 2 filtering device, the 2 transfer tubes to the bladder, and then the tube to the outside world. So just be careful, ureters and urethra are very similar in spelling. Nephro. It's another word root for kidney. Your nephrons are the functioning part of the kidney. Of course, they filter. And what you got to remember is the kidneys also reabsorb. And that's very important. Most of our water is reabsorbed. If the kidneys did not reabsorb water, we'd have to drink 300 gallons a day. Which kidney is lower and why? So you got to assume anatomical position. So this is the right side. This is the left side. But why? The lung? The lung, it's the liver. So the liver is on the right side of your body. So it's a little bit lower. The right kidney is a little bit lower. So not that big. They're only about 5 to 6 centimeters. But they're working all the time. Here are the ureters. You got 2 of them. 1 bladder and 1 urethra. Cysta we had already for bladder. Glomerulus, that is the blood vessel. So we have a blood vessel going into the kidney, and then it gets pushed inside this capsule, and then the blood goes out. So this capillary bed that's inside the corpuscle, that's the glomerulus. So I call it the meatball. Nephron for kidney, pylo, renal pelvis. So on the image, I'll show you these parts. Urine is easy. Uro, urino. Ureter, urethra. Urine, urea. Cysto for glomerulus. And then nephro for kidneys. Think of nephron. So middle lower back, they're usually a little bit higher than most people realize. Most people just go where their lumbar is, but it's just a little bit higher than that. 2 functions, regulate fluid and pH balance. So your blood pH needs to be 7.4. So the kidneys will directly get rid of extra acid or extra base to keep you at pH 7.4. What is the other organ that regulates blood pH? Do you guys remember? Covered it last week. So remember, hyperventilation, holding your breath, CO2. So the other body system that regulates blood pH is respiratory system. So you have extra oxygen, your blood pH will go up. If you have extra CO2, your blood pH will go down. Because carbonic acid is acidic. So you have the afferent blood vessel. So afferent is going to the kidneys, and you have an efferent pathway going away from the kidneys. So blood going in and out. Renal pyramid is easy, kind of triangular shape. Creating balance. So homo, same. Stasis is the stop. Stop there where you are in balance. So we have two mechanisms. So we can dilate the blood vessels going in and out. So if we constrict them, higher pressure, more filtration. Ureters. So we have two of those, one for each kidney going to the bladder. And then urethra, only one. Just remember. All right, everyone point to your prostate gland. Good, that's the right question. Women, you don't have one. So, of course, this is the digital exam they'll be referring to. So, only in males. It produces about 30% of the ejaculate. Now, the thing is, the urethra also goes right through it. So, from the bladder and then the vas deferens, they join inside the prostate. So here is the image. We got the urethra passing through the prostate gland. And you can see how if this gets enlarged, it can cause stenosis, which is the leading cause of urinary tract infection in males. BPH in the urine pooling behind it. Inflammation of the bladder. Here we got inflammation of the kidney. Which one's more dangerous? Yep. So bladder infection, that's your regular UTI. They might give you some medication, some painkillers, but they send you home. All right. Drink plenty of fluids, get rest. But if it is a kidney infection, they admit you to the hospital. Because if your kidney shut down, you're going to die. Right? At minimum, you need 10% kidney function. If you are below 10% kidney function, then that is considered kidney failure. Difficulty, painful urea. Urgency means I feel like I gotta go. So the bladder is smooth muscle. Sometimes it spasms. So they got drugs for that, like Detrol LA. How does cranberry juice works in preventing? How does it work though? Because it's sour, because it's sweet. Yeah. So for bacteria to infect you, they actually have to lay down kind of like a foundation called a biofilm. So if your bladder gets infected, right, that's really bad because not only if there's bacteria, they're actually embedding and taking hold. They're making a home for themselves along the inside walls. So what you do when you consume cranberry juice is that there are certain sugars that will prevent the bacteria from hanging on to your bladder or your kidneys so it can't cause an infection. So when you do have a UTI, based on the nerves, it's lower back pain that is a signal for UTI or kidney infection. So be careful if you have that. Pain back here and a fever for no reason, it might be an infection. Catheters. A couple types of catheters. So this is a Foley catheter. You will insert it. Some Foley catheters, did you have to put one in or use one yourself?
I had to put one in.
Yeah, for a male, most important thing is you do not want to use gentle touch. You got to grab the penis firmly to insert the catheter. If you do not grab it firmly, then they'll get erect. So just be careful. If you're doing a complete collection, right, just measure it before you empty it out all the time. And if it is a balloon catheter, train the patient. When you wake up from surgery, it's going to be uncomfortable. You do not want to try to pull this out. Let me deflate it first. Non-invasive, condom catheter. So it'll just catch urine like a regular would, a Foley would. Maybe you have to ask for another medication on top of it. Peritoneal. Do you guys know where your peritoneal is? So it is the membrane that covers all of your organs, right? That's the visceral peritoneal. And the membrane that covers the cavity of your abdominal cavity is the parietal peritoneum. So it's a membrane. Any membrane can then act as a filter. So you guys heard of hemodialysis, right? What's hemo? Blood. So hemodialysis, they take your blood out, the machine filters it, and it puts it back into you, right? So if you're on hemodialysis, how often do you have to go in? Yeah, 2 to 3 times a week. How long does it take? Yeah. So what happens if you miss an appointment? Guess what? That machine's already booked up, right? What if you need to travel? You're screwed. Yeah. You're gonna have to call around, see if there's a dialysis clinic for you. But if you can't afford one, we can use the peritoneum to filter out toxin. So this stuff is super salty. Anytime something is salty, it's gonna suck in water, right? So it's gonna suck in water. So you're gonna put it in your peritoneal cavity, and then that membrane is gonna act as a filter as it sucks in fluid and toxin. So when you rinse it, it's going to be dark, almost Coca-Cola color, because of all the toxins and waste product. Rinse, repeat. Rinse, repeat, until they find a kidney for you. Lithotripsy. So we mentioned the sonogram, the sonic waves. So they'll put you underwater, and hopefully those sonic waves will break up the stones into smaller pieces. And then you just pass the smaller pieces. Here we have a tumor or scar tissue. So definitely you're going to lose that much kidney function. Now the good thing is with the kidney, if you're a donor, right, you only got 50% of your kidneys, but the kidney will actually enlarge some to compensate, and you might end up with 70% function or even 80% function of normal instead of just 50 because you only got one left. And when they do the transplant, they leave the old ones in there. They just hang out, all atrophied and shriveled up, but it's more difficult to remove them. Are you guys on the donor list? So a lot of times they'll have like a round robin donor because you have to get all those surgeries done at once or someone might change their mind. So if you're not a match for your family member, but you're a match for another patient, but there is a match somewhere else for your family member, then you guys can kind of like trade organs that way. So it's all done at once, and sometimes it'll be like 20 different surgeries happening on in one night because we don't want one person to back out, and then that's it. There's 10. Yeah, the barter system. Because in America, we can't sell organs, but everyone else makes money off of it, right? Off of transplant.